constrictive pericarditis, we are not going deep into it because pericarditis is enough for you. Constrictive pericarditis, only you have to know why it is called as constrictive pericarditis. So in stages I have told you there is acute, subacute and chronic. So what is acute? It stays in your body only for less than 3 weeks of time. Okay. So what is subacute or recurrent? Okay, if that acute type of pericarditis is cured once and also it again occurs after a few days, when it is occurring, it is also a type of acute type. Okay, that acute type is occurring recurrently, that is called as subacute or recurrent type of pericarditis. Third one I have told you, chronic, that the pericarditis is sustaining in your body for more than 3 weeks of time and it is kind of severe. Okay. This chronic type of pericarditis is called as constrictive pericarditis. So usually when it is, I have told you in pericardial effusion, mild and moderate stage we call it as pericardial effusion. When it is getting into severe and chronic stage we call it as what? In pericardial effusion. In mild and moderate stage we call it as pericardial effusion. What if it gets into severe and chronic stage we will call it as cardiac tamponade. Same as in pericarditis, in mild and moderate stage we will call it as pericarditis. When it gets into severe and chronic stage we will call it as constrictive pericarditis. Why are we calling it constrictive pericarditis? Because those thickening and rigidity in the pericardium is far more increased when compared to the pericarditis. Okay, hence there will be a constriction in the pericardial layer and we call it as constrictive pericarditis. Okay, this constrictive pericarditis is often misdiagnosed as your restrictive cardiomyopathy and hence there will be a differentiation table where you can see the difference between your restrictive cardiomyopathy and constrictive pericarditis. Okay, so why now? I told you pericarditis is often misdiagnosed as restrictive cardiomyopathy. It is mimicking restrictive cardiomyopathy because of the rigidity. Okay, in constrictive pericarditis, that rigidity is increased far more than compared to your pericarditis. Then it will be more similar to your restrictive cardiomyopathy. Okay, in both stages there will be restriction. The only differentiation is that there in restrictive cardiomyopathy the restriction will be present in your myocardium. In pericarditis there will be restriction present in your pericardial layer. Okay, so maximum all the signs and symptoms, this pulses, swab, oxes, everything will be similar in these two cases. Okay, you will be not able to differentiate it. If you want to differentiate it, there will be a differentiation table and certain criteria to differentiate. You will be learning that in second year. Okay, you will be learning that in second year. If there is a question asked in your question paper in the previous years, we can discuss it later. Okay, right. So next we get into the treatment mechanism of your treatment modalities of your pericarditis. So first line of treatment we get into the medical management. So in medical management, what type of drugs can be prescribed to this type of pericarditis? Diuretics. Okay, fine. Diuretics, beta blockers. First and foremostly, it is caused mainly due to an infection which is leading to inflammation. So what type of drug you will be giving? Antibiotics, antiviral, anything. Okay. So after that, it is causing a pain. I have told you pericardial drug. It is very similar to that of the angina which we are experiencing during your infraction. So we will be giving your anti-anginal drugs. Okay. Then analgesics. After that, we will be giving diuretics. Okay, fine. After that, when we are getting into surgical management, there is no sort of treatment for pericarditis. You can't do any type of replacement therapy at all. We can only go for transplantation. So before the transplantation, if you want to sustain the patient, we will be going for ICD and CRT. I have told you already, right? What is ICD and CRT? Intracardiac defibrillators and resynchronization therapy, cardiac resynchronization therapy. Okay, ICD and CRT, which will be similar to that of your pacemaker, which will be helpful for your ventricles to contract the blood out. Okay, so there is no sort of surgical treatment. We have to go only for cardiac transplantation. If there is no availability for heart for get into cardiac transplantation, they'll just do managing through your medicines. Okay, until your pericarditis is surviving or the patient is getting survived. Okay.